So what's worse than one herniated disc? Two herniated discs. So imagine you have severe leg pain. You can't sleep, you can't work, and you have left arm numbness. Well, that describes my next patient. So let's take a look and see what she's got. So this patient came in with the low back pain, and then the pain going down her front of her leg, and then her arm was numb. So when we checked her, we found in her low back a couple issues. So normally the spine should be straight. You can see that it's not. Here, there's quite a bit of curvature. Well, the pressure down here is what was causing a lot of the general low back pain. Then the leg itself was more responsible from what I found up here. She had another disc up here that was really, really swollen and tender on her. And then in her upper back, you can see that it fails to be straight up here. And it kind of goes this way. And up here, it goes that way. And that's where her arm stuff was coming from. All right, Miss Kelsey, so describe to me how bad you were hurting when you came in.
It was honestly the worst pain I've ever been in my life. It was really bad nerve pain all the way down my leg and around my hip. I ended up having to take 2 days off of work and just laid in bed literally all day. Yeah, I mean, the worst pain ever.
You've never had any pain like that before?
No, oh my gosh. And I've tweaked my back like a few times throughout the years, but it was never that intense. But yeah, I basically laid in bed for 4 days crying on and off. And then I think I was even crying when I came in here.
I remember that, yeah. Before I even opened the door, I heard you sobbing, and I was like,
yep.
Oh, she must be in pain.
It was awful. I mean, I couldn't sit for more than like 10 minutes. I could stand for maybe 15. But yeah, I mean, it was debilitating for sure.
Yeah, if people have never had a herniated disc, they can't appreciate the amount of pain that is, and you can't get away from it.
Yeah.
It is unrelenting.
Yeah.
When it's swollen up like that.
Definitely.
So she came in, and she also had some left arm numbness that she complained about, but she could hardly think about that if she had so much pain. So we checked her out, we did some x-rays, and we found quite a bit of nerve pressure at a couple spots in her low back. You know, she had 2 discs that were really swollen, resulting in the front of the leg pain and the general back discomfort. Mm-hmm. And then up top, I did find a disc as well here, not near as bad as the lower ones, but that was causing nerve pressure that was resulting in her left arm numbness. So tell me about the response you got. You know, we treated her aggressively. We saw her daily. That was Monday, and
yeah.
You know, today's Saturday. So how fast did you get some relief?
By Wednesday, I was like, oh, wow, this is actually really working. I've had, I think, 3 adjustments at that point. And then Friday, I was able to stand all day and work. I was even able to sit at my desk for a few hours and get some work done. And I was able to go out to dinner last night, which was like really exciting.
Especially after all the quarantine. You don't want back pain to take you out of being able to go out to eat.
Exactly. So yeah, I mean, it's funny, you just take certain things that you do every day, like putting on your shoes and bending over to wash your face, like, for granted, and then yeah, I can do all that now, so I'm really thankful.
Awesome. Well, I'm glad you had such a great response. So I found some of the same areas that we have been working on. She's obviously symptomatically doing awesome, but we have not stabilized the issues yet. So in chiropractic care, we don't just get you out of pain, we try to stabilize the structural issues so that it doesn't come back all the time. And that's kind of the phase of care we're in right now. So we're going to continue on with treatment, and we're going to go ahead and adjust the areas that we found today in the exam. This is the one that affects that arm. Down the chin. Doesn't get any better than that. And look at this one. This was more the one that was responsible for the front of the leg issue. Through the backs of the shoulders. Great. Nice. All right, let's just recheck everything. Mm-hmm. I'm going to check for the motion, make sure it's all better. Great. Let me check this little part, back and forth. And what we're looking for is for the motion to be better. These discs become problems because they got damaged and the bone shifted and the segments become stuck and they just kind of stay that way. So for her, long term, she's going to do really well, but she has to maintain that because the disc damage will always be there, and just daily activities, sitting, what have you, slowly over time, they get stuck, they'll start causing problems again. But if you stay under regular care, she may never have this problem again. So she's done great so far, and I have no doubt she'll make a full recovery, and this will be something hopefully she'll never ever have to deal with again. So,
and
good job.
I'm so thankful.